Hi guys, I'm going to do a quick adult one total recap, run through a couple body systems. Hopefully this will help you for your final, just a basic review. Okay, I apologize, my kid is in the background if you do hear him. So we'll start with the cardiovascular system and with hypertension. So remember, with hypertension, think about it like a water hose. If you increase the pressure of the water inside the water hose, it's going to cause more pressure going through the water hose, okay? That causes increased systemic vascular resistance and can damage the arterial wall, okay? That can in turn cause heart damage, kidney damage, and other things, okay? For nursing assessments, patient can be totally asymptomatic, meaning without symptoms, okay? Patient may complain of headache, okay, due to increased blood pressure to the vessels and to the brain. They may complain of dizziness or blurred vision, okay? However, hypertension is known as the silent killer, okay? For a diagnostic test, to diagnose high blood pressure, typically you'll need 3 different readings of high blood pressure, okay, of hypertension on 3 different accounts, okay? If the patient does come into the ER and they're extremely hypertensive, or if they're in a hypertensive crisis, like 240 over 150, okay, we're going to do an EKG, which can show us left ventricular hypertrophy, so thickening of that left ventricular wall, okay? We're also going to check a urine to see if they have early kidney damage, which can be seen with protein in the urine, okay? When we are not perfusing our kidneys appropriately, the kidney is unable to do what it needs to, and you will then have protein secreted in your urine, okay? If you tighten up the constriction to the kidneys and you're getting poor blood flow to the kidneys, you may see an increase in their kidney function, such as their creatinine is going up and their GFR is going down, okay? Some medications you guys might need to be aware of include ACE inhibitors, beta blockers, and diuretics, okay? Remember, your ACEs are your prils, your beta blockers are your LOLs, and your diuretics are HCTZ and Lasix, Bumex, okay? Spironolactone.
I just threw up.
Okay. Nursing care for some nursing considerations for hypertensive patients include the DASH diet, okay, which is dietary advancement to stop hypertension, something like that, okay? So it means a low salt diet, things that are not going to raise their blood pressure, okay? Sodium restriction, because where sodium goes, water goes, and that will increase your blood volume, which will then increase your blood pressure, okay? We want less than 2 grams of sodium per day. And then educate patients on orthostatic hypotension, which when they stand up, they can drop their blood pressure. They're at risk for passing out. So if they're on any of those medications, you tell them when they move from lying to sitting, they need to sit on the side of the bed, and then they can stand up, okay? Making sure they're taking their blood pressure medications is a big thing so they don't damage their kidneys and end up on dialysis, okay? Having home blood pressure monitoring and notifying their provider if they feel like their medication is no longer working, because a lot of these patients are put on step therapy, started on one med, then added another, and some end up on 5 or more blood pressure pills. All right, we're going to move along. Next topic is heart failure, okay? This is an inadequate pumping of the heart, okay? So this is a pump problem, a muscular problem, okay? This could be due to having a heart attack. This could be due from years of high blood pressure, and now the left ventricle is so hypertrophied that it's not pumping as effectively, okay? This leads to decreased cardiac output, okay? With left-sided heart failure, remember, right side, you're going to back up to the body. With left side, you're going to back up to the lungs. L for lungs, okay? Left to the lungs, you're going to have crackles. You're going to be short of breath, trouble breathing with lying down, okay? Shortness of breath with exertion. And then the right side, you're going to back up to the body. So you're going to have peripheral edema, hepatomegaly, splenomegaly, okay? JVD, okay, which is jugular vein distension. So when they lay down, this is going to be very thick, okay? All of these things, a lot of times the patient will have left and right heart failure combined, okay? So they will have multiple symptoms, and you'll be like, well, wait a minute. It's because they have both sides of their heart affected, okay? Some things for these types of patients, we call them CHF patients, congestive heart failure patients. Daily weights to monitor in case they gain too much weight in a short amount of time. 2-liter fluid restriction per day because they already have too much blood volume. They can go into fluid overload very quickly. And monitoring their eyes and nose, okay? Making sure they're putting out what they are taking in, okay? These patients will also be on ACE inhibitors, diuretics, beta blockers as well, and possibly digoxin to help that heart beat more effectively. Remember, this is a pump problem, so the pump might be beating like this, and those drugs are going to help it beat more effectively, okay? We do want to report, this is big for the NCLEX and for testing, any more than 2 pounds of weight gain in 24 hours. So 2 pounds is where you want to be looking at in that area, okay? Some risk factors for coronary artery disease, which can then lead to congestive heart failure if someone has a heart attack. So we're kind of sliding down a little bit. So CAD, coronary artery disease, hypertension, smoking, diabetes, obesity, okay? Top 4 all the time, okay? Meds to treat this, well, statins for the cholesterol, aspirin, ASA, and then nitrates, okay? Nitrates are going to dilate the vessels, okay? So getting extra oxygen, extra blood to the heart by dilating those blood vessels, okay? For CAD, we want to have these patients exercise, 30 minutes a day if we can, at least 3 times a week. Low-fat diet. Stop smoking, stop alcohol, all of that health promotion type stuff, okay?